everyone, it's Lauren Alvin with Add a Pup Dog and Puppy Training. Training Tip Tuesday. I've got something important to talk about this week. I think they're all important, but this is one that I think is particularly important. Medication. I firmly believe that it is humane and often necessary to use medication for some dogs who need it. I think it's unfair to have a dog suffer through something unnecessarily because we feel icky about giving them a pill. And I'll explain not totally how medication works, because I'm not a vet. Disclaimer, not a vet, don't play one on TV. I'm talking about this as a trainer. But I'll explain how it usually goes. So I don't recommend, I'm not qualified to recommend, but it's not like everyone who comes and says, my dog's jumping on me, I'm like, give him a pill. Medication is often necessary and definitely an option for dogs who have particular issues or are dealing with particular challenges. So some red flags to me when I'm talking to a client that tell me we need to talk about meds, or rather you need to talk to your vet about medication. If we can't meet the behavior change trifecta criteria. So this is based on science, but the breakdown into 3 comes from Debbie Jacobs, who's a fantastic trainer. Fearfuldogs.com is her website. She's got books, she's got wonderful webinars. Check her out. It always comes down to this equation, which I mean is science. So number 1, we identify the dog's triggers and we prevent them from being exposed to it. So if the dog has severe separation anxiety, their trigger is being left alone. That means we can't leave them alone anymore. If the dog freaks out whenever they see children, that we need to prevent them from being exposed to the trigger. That means they can't be around kids. Don't go walk near the school, don't invite kids over, give your children up to an orphanage, not really. Whatever it is, you prevent them from being exposed to the monster. That means they're not going down the brain pathway of, let me draw my doggy brain. Every time they're exposed to a trigger, they're going monster, freak out, monster, freak out, monster, freak out. This is a well-worn neural pathway. It becomes their default. What we want to do is we put up a detour. So you're not going to go down freak out highway anymore, because guess what? We have closed that road. You're not going to see them at all. That's step 1. 2, we change the emotional, neurochemical, physiological response to the triggers. So often this is counter-conditioning, constructional aggression treatment, behavioral adjustment training, I always get them mixed up. Look at that, other things, other behavior modification protocols. We change the way the brain responds to the trigger. So for counter-conditioning, we would go, is that a monster at a low enough intensity where they see it, but they're not freaking out? And we go, heck yeah, that's a monster, get some chicken. Monster chicken, monster chicken, monster chicken, monster chicken. This becomes well-worn, and because there's a big oxytocin happy hormone pot of gold at the end, because it's chicken, it makes a big impact. They're not being exposed to the trigger in an intensity where they'll freak out, which means they're not going down that highway, which means it shrivels up and dies. That becomes their new default. Step 3, we teach them new skills that the people and the dogs can use around the monster. So that might mean maneuvering them away from a monster. If they don't like kids and kids are always like, fluffy dog, you can teach fluffy nose target on you, dog's back with you, sorry, see you later, etc. Or do you want to see him do some tricks or something? Just, maneuver your dog away. New skills for a dog with separation anxiety might just be sitting in your crate. So that gives us some new pathways to go off of on the happy brain. You can't think and you can't learn new things when you're freaking out, but if we've got the happy brain, you can make decisions about your behavior. So that's what we want to do in behavior modification. If we can't meet these criteria for some reason, which I'll explain, then I'm going to say you should talk to your vet about the possibility and the appropriateness of medication. If we cannot prevent their exposure to triggers, if a dog is terrified of every single person, or the sky, or grass, or being indoors and being outside, or having people near them, or you shifting your weight, or looking at them, or being positioned between them and an exit anywhere. If you live in New York City and they're terrified of strangers or sidewalks, something you can't avoid or you can't predict, therefore you can't avoid it, then you need to come at it neurochemically. You need to talk to your vet about medication. Because if we can't avoid it, we're going down freak out highway. If you're on freak out highway, your reptile brain is on overdrive. Your sympathetic nervous system is activated. You can't learn new things. The alarm bells are going off here. It's drowning out any decision making that might go on in the prefrontal cortex. Survival trumps everything else in the brain. And if the brain is going, you're gonna die, there's a guy with a beard, then it's going to drown out anything else they can do. So if we can't prevent them from being exposed to it, we can't change the way they feel about it. If we can't change the way they feel about it, we don't have this new road, which means we can't teach them how to do new things around it. Sometimes we can't even teach them how to do new things at all. If a dog is terrified of people being near them, how are we supposed to counter condition leaning over them? If that's another trigger, if simply existing in the world is a trigger for them, then there's no way you can counter condition existence, because I can't turn existence on and off. It's there. So if we can't come at it through training, we have to start somewhere. So I say qualified trainers can address the behavior you see on the surface, the sits and the downs and the nose targetings, and we can address the emotional states beneath that. So, we can help a dog regulate arousal if they're jumping up. We can help a dog feel happier around people with beards so they can sit or nose target. But when it gets to the things that influence those emotional states, neurochemical reality, or genetic programming, or epigenetic, or early puppyhood experiences to a point, that's kind of the bedrock, brain matter, chemical bedrock. And that's not something I am qualified to deal with, because I'm not a veterinarian. I'm not a neuroscientist, and I'm not a board certified veterinary behaviorist either. So if I can't do it on the surface and the subsurface, and we're getting to bedrock brain reality, then that's when you need to talk about medication. Like I said, I do not believe that medication is inhumane. I definitely don't believe that it's a cop-out. Just like with humans, if you know or are someone who's ever experienced depression or anxiety or anything, it doesn't feel good. You're not choosing to do it, and it's not a cop-out to say, my brain isn't working right. I need help. I need help. And it's our duty and our honor to make that decision for our dog. So I take it seriously, and I think that it is humane to make a decision to give medication if it's needed. So generally, again, not a vet, but generally, behavior modification medications are prescribed for about 6 months or so. Not a vet, that's just usually what is done, to give a scaffolding. So we soften up the bedrock of that neurochemical reality so we can get a little more training in. And then once they have these new patterns of behavior, we can get rid of the freak out, and we can build up the chicken, and they've got all these other things that become their new defaults. When they have those new patterns in their brain, then we start chipping away at the scaffolding of the chemical assistance until it goes away. Some dogs are on medication for their whole lives, just like there are some people who are on medication just for their whole lives. It's not because they're failures, it's not because they're bad, it's just because that's the way their brains are. And everyone deserves to be happy, so sometimes brains need help. So yeah, medication. I will post an article from Dr. Karen Overall, who is a board certified veterinary behaviorist, that has all sorts of nerdy details about it if you like. But if you have any questions, talk to your vet or give me a message. I'll send you some handouts and stuff. There are a couple vets in the area that are really fantastic and behavior savvy. And if you watch the behaviorist video, we're lucky. I actually looked it up. We have like 60 veterinary behaviorists in the country. We have 3 in the area. So there's help. There's help to be had. Dogs and people don't have to suffer. Let me know if you have any questions. You're awesome. Take care. Bye-bye.